Vax it and mask it, as some experts are saying that all across the country. Cases of COVID-19 are rising, even in states like New York. So my first question to you has to be, are we in trouble?
Yeah, so we're not in trouble yet, but I would say those people who are choosing not to get the vaccine are in trouble, because over 99% of the deaths are now all unvaccinated folks. Over 90% of all the hospitalizations, ICU admissions are all unvaccinated people. So if you don't have your vaccine yet, please go get it, because these new variants are much more contagious and they are troublesome for those who are not protected.
Right, and the Delta variant is right now making up 83% of the US COVID-19 cases. Many are saying this Delta variant is like COVID on steroids. I'd like to get your insight into how you're looking at this variant and how much damage can this cause to even vaccinated people.
Yeah, it's troublesome because it's much more contagious. So you're much more likely to catch it than the original strains of COVID-19 that were circulating at the start of the pandemic. And the other problem is once you get infected, there's much more virus in your airways, they found. So the viral load is much higher, and that is what determines how sick you'll become. So it has a potential to be more dangerous, and even in those who are vaccinated, the vaccines right now are protecting against hospitalization and death, but they aren't as effective at completely neutralizing the virus. So we can still get milder cases of it even if you are vaccinated. So that's why we're seeing a lot of shift back towards masking, especially when you're indoors and in public spaces for that reason.
Right. While we're talking about this, Florida Governor Ron DeSantis actually blames a seasonal pattern for the excess amount of cases that we're seeing in Florida. But isn't this due to the low vaccination rates there?
Yeah, absolutely. One, seasonality, usually it's actually winter and fall where the cases go up because people are spending more time indoors and that's how it spreads. One can argue in the summer, maybe people are inside more with air conditioning in Florida, but Florida also has very low vaccination rates, and you can't ignore the fact that the places that have much better vaccination rates, the cases have dropped completely. And President Biden even said that this is now a pandemic of the unvaccinated. That's how different it is. If you're a vaccinated versus unvaccinated person, your risk is much, much higher.
Right. So could you sort of locate these areas for us? Where is it more risky? Where is it still okay?
Right. So it depends state by state. I know, unfortunately, Arkansas has a low vaccination rate, so their healthcare system is already getting overwhelmed and the cases are surging. We're seeing it in Alabama as well. And then Kentucky, actually, the governor yesterday said that he is moving back towards a mask mandate for the same reason. All low vaccination states who are seeing surges of this virus and increase in hospitalizations, which is what's most worrisome.
Right. These masks, do you think will again become a political issue? How do you look at it as a medical professional?
Yeah, I don't know why it ever was a political issue. It really should not be. We know that they work, that they protect people. I hope it does not become a political issue, but unfortunately it might be. Unfortunately, the vaccines are a political issue. All of these things are just basic medical facts that we know work, that save lives and protect people. So it really shouldn't matter what your political affiliation is if it's something that's going to help you and other people.
Some states or some cities, I must say, are now bringing back travel restrictions from states such as Missouri, where the cases are really high, the deaths are really high as well. So, they're making them do quarantining if they come from that state. My question to you is, should other cities follow this? And again, my follow-up question to you would that be, how can these low vaccinated states eventually affect states that are at 70%?
Right. So, those restrictions may need to be imposed because we know a lot of the spread is from travel. And so those states with the low vaccination rates, it can actually hurt other states, even those with good vaccination rates, because if it starts to spread, it can still affect those. And remember, these vaccines aren't meant to be 100% cure. You can still catch milder forms of the infection and spread it as well. And, in someone it might not be so bad, but they could potentially spread it to a high-risk individual where it could be deadly. So it is a concern because an outbreak anywhere is an outbreak everywhere. What's happening in Missouri could affect us, in a few weeks very easily.
And just talking about vaccines, Pfizer has come up with the fact that it's working on its booster shot already. It has actually stated that it is seeing the immunity rate go lower. It's waning off, it's saying. How are you looking at it? What insight could you give us about what's happening with these booster shots?
Right. I really want to see the data. I'm involved in the Pfizer trial, both the original and now the booster one as well. But we need to see the data. They're saying this, but, for scientific evidence, we like for independent scientists and sources to review it to make sure that it's valid. So if that is the case, that the immunity is waning, then yes, absolutely, we probably will need a booster, but they haven't really released those numbers yet. So I would like to see that first, because we do have other data showing that mRNA vaccines actually have very good immunity and possibly even for years. That's why we're now looking at it for flu vaccines and other vaccines. So we really, before making any assumptions, we need to really see that information first.
Are you hearing about perhaps this becoming a yearly shot just like the flu shot?
It may, if we have continued mutations. Right now, all of our vaccines are holding up well against the mutations, meaning they still prevent death and hospitalization. But if it gets to a point where, one or any of the vaccines can't handle a new mutation, then we may have to have new shots every year, every 2 years. It really will depend. The next few months are critical. And unfortunately, the unvaccinated folks might be making deadlier strains, because that's how it mutates. If it has a chance to pass from person to person, it doesn't mutate as much in vaccinated people.
Right. Let's now talk about breakthrough infections. It's a huge issue. I have about 5,500 people who have had this or have died from this. This is happening to fully vaccinated people. I'd like to know, what is it doing to the body? How is the COVID vaccine helping them? And what is it surpassing where, they are getting these infections, and what kind of infections are they getting?
Right. So, breakthrough infections are expected. I don't think it's anything to necessarily worry about. Again, what a vaccine does is that, if you're lucky, it stops an infection from happening altogether. But the main issue is that it's supposed to make an infection milder if you do catch it. So that way your immune system can fight it off and it doesn't turn into a hospital admission, ICU admission, or death, which is the worst, obviously, outcome. So again, vaccines aren't meant to completely avoid a disease altogether. It's to avoid severe disease, to avoid death. So breakthrough infections are expected, and majority of them have been very mild. So again, that's also expected. But if we actually want to get to a point where there's zero breakthrough infections, then more people have to get vaccinated, because the less infections that are spreading, then there's less likely to even have those breakthrough ones. That's the best case scenario, and that's what we've seen with other vaccines in time.
Right.
Polio we've eradicated in multiple places, and that's because they got to the point where there were no more breakthrough infections.
Doctor, let's now talk about children. I have a couple of questions on it. Yesterday, the American Academy of Pediatrics came up with this recommendation where they are saying anyone above the age of 2 in a school setting should wear a mask regardless of their vaccination status. There are so many debates going on in the country right now about how to open up schools safely. How do you look at this? What kind of information are you getting about these vaccines in children?
Yeah, I think that's the right move to require masking, because right now the vaccine is only available for age 12 and up. So that leaves all the children under than that unprotected. And we already know how harmful it is to keep kids out of school. They're already having a lot of problems developmentally, from a learning standpoint. They need to be in school. So in order for that to happen safely, everyone has to mask. That way we protect the younger kids who don't have access to a vaccine yet. We then also protect others, right, who can't get the vaccine for medical reasons or any other reason, and it really helps keep schools safe all around. So I think it's the right move, and most children actually don't have problems wearing masks.
Right. In children, we are seeing a low rate of vaccination. What do you think is the biggest cause of that?
Again, I think it's political. Most children under the age of 18 can't get vaccinated without their parental consent.
Right.
So unfortunately, if parents have certain views on vaccines, it, boils over into the children as well. The other issue too is I think that there's a fear that, of long-term consequences, especially in kids, but these vaccines are even more strictly regulated in children. And to be honest, if your child gets COVID-19, that's far, far worse. Kids are not immune like we thought they were before. We already have had over 400 deaths in children from COVID-19, thousands of hospital admissions, and they have long-term consequences. So my message for parents would be you're actually protecting your child more by vaccinating them than by waiting and not doing it.
Could this be a required immunization vaccine that is, needed for any child? Do you see it becoming that?
Yes, it very well could be. Already, certain vaccines are required to attend school, so this could very well just, be part of that. And again, I think it's the right move, especially when we know that the vaccines are very safe and effective, and it can prevent terrible outcomes.
Right. We're expecting results of the ages 2 to 12 by the fall, doctor. Probably end of September is what I'm hearing. And then we'll hear about 6 months, 2 years. Could you give us any insight into what these trials are doing and, how effective could this be?
Right. So, I think it's great that we'll get this by fall, so that way we can continue to vaccinate even the younger population. And we do expect that it's going to be very similar to what we're seeing in the older kids and older adults, that it will be very effective in this age group. We also expect it to be very safe in this age group. Of course, that will be confirmed when the trials are done, but already thousands of children in that age group have received the vaccine successfully without any issue. And it's very important, especially as we move into school, to get out of this pandemic, because we need to protect the younger children.
Right. Meanwhile, we are again seeing disparities in vaccinations. Again, I'm hearing that Black and brown communities are still affected. Do you agree with that?
Yes, it's actually improved a lot since November, December, when the vaccine first was spoken about and was approved. I think the brown and Black communities have actually accepted it much more now. I think a lot of public education campaigns, speaking with their own doctors from their own communities, has helped. But there is still vaccine hesitancy, and so it's an ongoing issue. But thankfully, I think we're moving in the right direction.
Right. Let's now talk about Olympics, doctor. I'd like to know what you have to say about the fact that now we're seeing cases amongst athletes. Should this continue? Tokyo is already under a state of emergency. What is happening there?
Yeah, I mean, that it just goes to show that no matter how healthy or athletic you are, nobody is immune from this virus, I know a lot of people have misconception. It's older people with pre-existing health conditions, but I can't think of anybody healthier than an Olympic athlete, So it just goes to show we're nowhere near out of this pandemic. It also shows how important vaccinations are, because if you are vaccinated, you're much less likely to test positive, even for a mild or asymptomatic infection. We know vaccines decrease those too. And, it just goes to show that we may have to live with this pandemic for a while. Tokyo may have to reconsider things. It's all dynamic. Some parts of the world are already going back into lockdown mode.
Right. And a lot of these parts of the world, I'm asking you this because the WHO just came up saying that cases and deaths are climbing globally after the fact that they were actually declining. And all these countries that we're talking about that are going back into restrictions have low vaccination rates.
Right.
How does this look globally? Say the United States and other neighboring countries do reach the herd immunity, but other countries don't reach it. What happens then?
Yeah, so it's still a problem. We're not living isolated, right? Any outbreak, even if the rest of the world does not reach herd immunity, it's a big problem for the U.S. because this pandemic started overseas. So any problems that are going on overseas with infection outbreaks can be here within days. It can be, especially in a very populated city like New York or LA, where there's a lot of international travel. So, even in the last 2 weeks, we've seen cases go up almost 145% in the country. So I think, it's very short-sighted to only look at herd immunity as an American problem. It's actually a global problem. And it's in our best interest to make sure everybody has access to a vaccine.
Yeah, that's why all the developed countries need to send more and more vaccines out to the underdeveloped one. Just a couple more questions left for you, Doctor. Canada is opening up its border to fully vaccinated Americans on August 9th. Now,
Right.
you're seeing a lot happen with cases and deaths right now. We're seeing a spike in it. Could this be a bad decision to happen right now? How are you looking at it?
Yeah, I mean, it's all in the details, right? So just because someone's fully vaccinated doesn't mean they're not sick or able to spread the infection. So as long as they still have certain safety checks in place, meaning if someone comes and has symptoms, meaning they're coughing or has a fever, they should still quarantine, even if they're fully vaccinated, For the most part, the risk is much lower now to open the border than it was a year ago or 6 months ago. But with these variants circulating, they have to be very strict in really regulating even those who are vaccinated coming in. And I don't know, I feel like that will be a challenge to do that.
Right. What's your prediction for the next month or so?
So, I mean, the next month or so, it's still summertime. So there is possibility that even with surges, things can stay quiet. My bigger fear is fall and winter when everyone starts spending more time indoors. If you remember, last January was the deadliest month of the pandemic. And that's because it was winter, and cold, and everyone's inside where the virus can spread. My prediction, too, will also vary based on how many people go out and get vaccinated in the next month. If those rates increase, I think we'll be in much better shape. But I think only 50 to 60% of the country is fully vaccinated right now. So we really need more individuals to go ahead and get their shots.
Yeah, vaccines.gov is the website to find vaccine information and location. My last question to you, Doctor. A big news came out about India, our motherland, and they're saying the death toll from COVID-19 could be 10 times worse than the reported numbers. They're saying it could have been between 3.4 million to 4.7 million just in India. Do you agree with this assessment? And also, are you worried about India opening up the way it is right now?
Yeah, those are very sobering numbers because if you think about it, if that's actually true, which is very possible, it could be true, then India will have the same amount of deaths as the whole world. Right now there's like a little over 4 million deaths globally. And then if we now feel that there are going to be 4 million in India alone, that is a mass casualty. And it's very possible because even in the US, they're probably undercounted because many people die at home before the diagnosis is made, or, they die on their way to the hospital, and all of those cases are not counted, and as we know, India was completely out of resources. So there must have been so many COVID cases that weren't even accounted for. So I do believe that that's possible. And yes, opening up could be tragic. And it's very difficult because I know some people need things opened up for their livelihood, especially those that are living on the poverty line. But at the same time, a lot of non-essential gatherings could put India back into the crisis that it just was in a few weeks ago.
Right. Just a quick follow-up. Do you see the surge happening in the fall there as well, and a troublesome surge?
Hopefully not. It all depends on the regions of India too, because there are certain parts that are very similar to our winter. So those areas may have issues in fall and winter if people are not careful, if the vaccination rates remain low. Remember, despite how densely populated India is, the vaccine rates are extremely low. Right. So I think they really need to ramp that up to avoid any type of crisis situation.